Hello, welcome back to Acu Talk. So it's been a while. We want to talk about what's the majority in practicing acupuncture. There are several doctors already in the medical field. They can just get training and perform acupuncture on you, and also you can get from the specific training acupuncturists, which they may take 3 years for master program, or they take 3.5 or 4 years for doctor program. So majority of we learn is the classic methods from this book called Chinese Acupuncture and Moxibustion, quite thick like a brick. And it's made, the chief editor is Chen Xingnong. And the other one that if you practice, you might hear another one, 30% of the practice, they use this one as well. It's called Practical Atlas of Tung's Acupuncture, which is written by Master Tung's students and family members. So this one, Master Tung points, is mainly targeting pain management, and classic one you will see is really effect on internal medicine. I'm using both and more, so it's quite important when you practice to communicate with your patient and communicate with your colleague, because you're not practicing alone. Even though you own your own clinic, but your medical notes may be reviewed by insurance company or by other colleagues that they practice in the same field of you. So if you don't write clearly which theory are you using, it will create confusion. For example, there's one patient that come in with overdue pregnancy, and we do have reflexology points that specific on your feet, from ankle to the bottom of your feet. And also some practitioners, they use muscle area to treat you. So if you don't say, okay, I'm going to use theories that we practice on reflexology, it will duplicate for the contraindication pregnancy points of bladder 60, urinary bladder 60. So I see several times of confusion when one put the needle in, which is trying to target the area, not on the specific points, because the points are quite little. The tiny, like how small it is, it's not a huge area, so it's really small, like a points, even smaller than our nail size. How can I say? It's like pinpoint. You pin on one acupuncture points that may stimulate overdue or harder pregnancy woman, but the area is quite big. So when you practice, you might overlap a similar area. When another colleague come in, they might see, oh, you are practicing in dangerous area because it should not. So first of all, when we learn in the class, a lot of professors, they trying to alert you, do not touch the points of contraindicated to pregnancy. But when they alert you, it's like you learning driving. When the coach alert you, they emphasize and enlarge the effect that you will remember forever in your practice life. But when you're actually practicing, you will notice dangerous separate phases. Like for example, pregnancy, you have first phase, second, and the late pregnancy phase. And also what's the purpose of using that points matters. And is that strong effects when you touch the points, it will get your delivery a baby right away? No, even though you put electro acupuncture Eastern machine on it, it won't stimulate right away. There's so many factors to create one scenario coming up. So don't be afraid when you are practice by yourself. Of course, strictly follow the rules, but you need to clearly know which system are you using. And another one is the second metacarpal bones system, which is reflects all our spine along your second metatarsal bone. And this part, when you treat, like for example, pregnancy, I use pregnancy because gynecology and the pregnancy is kind of a sensitive case when you do malpractice. So that's why I always alert first. And commonly on the second phase of pregnancy, they will have neck pain, and they will carry a heavy breath and heavier on their belly. So we might use the second metacarpal bones theories to mimic our spine, which neck is right here. However, there's another contraindication for pregnancy. It's right here, just here, and a little bit towards your thumb, you will have Li4, which is 合谷穴. And this is another sensitive area. So if you didn't clearly stay on your nose, you might causing malpractice, or you might causing a confusion for the patients as well, because there are some important part that you need to explain to your patient, like, oh, I won't touch here, here, here because it might contraindicate it, or it might not, we won't use these points. And the second time, maybe another doctor come in and he or she may do it, and then it will causing a huge misunderstanding in a patient's mindset. So how important is communication between patient and the practitioner? For example, there is one patient sensitive of skin, and he or she just cannot handle strong stimulation, and they will always alert or nervous when the needle's coming or they know where it goes. And then if you don't tell them what's the function of that, or you just say, because I'm a doctor, I don't need to tell each step what I'm doing, it might reduce effect. It's like if you do one, you can have a double effect if you explain a little bit, oh, I'm doing this, is for what? Then they will say, I had acupuncture, either it's miracle treat me, or it's weird that I had thumb pain and I got all body needles. Like that kind of two extreme ways of misunderstanding there. So for example, today I was looking at a case of thumb pain, and we do have points that are on their inner thigh area, and we do have points that mimic their thumb, which is on their big toes, and also on their shoulder area. That's all open up like liver channel, and open up their sanjiao channel and large intestine channel. You will see weird. Even for colleagues, if they specific practice one methods, it feel weird. So you need to communicate, and also you need to select. Do not just apply all double parallel everything on both sides. It will scare people out, because still a foreign device go into your body. No matter how much you know our body have space for that, you know it's going to scare people for the first time trying. So this is what I want to emphasize for today, because there are a lot of, each field, they have a lot of misunderstanding inside the field and outside the field. Specific for healthcare, it's really important to communicate with each other and tell clearly what should they expecting, and what's the function of it, and it will clear up the mind and help you double up the effects of your treatment. We'll see you next time. Bye.